So, why is a health coach the missing piece in your perimenopause puzzle? If you've been struggling with brain fog, crushing fatigue, anxiety, and symptoms that are affecting your career, and your doctor keeps telling you everything is normal, I need you to understand something critical. Your doctor isn't failing you on purpose. They literally weren't trained for this. I'm Dinah, an integrative health practitioner, and today I'm going to explain why a health coach might be the missing piece in your perimenopause puzzle, and why this matters more than ever for your career, your relationships, and your future. Let's start with the medical education gap. Here's a statistic that should make you angry. 80% of doctors are not prepared to support women in perimenopause. Why? Because it's not included in the medical school curriculum. Let that sink in. Perimenopause is a transition that affects half the population, can last 7 to 15 years, and impacts every major body system. Yet most doctors receive less than 1 hour of training on it, and some get none at all. Your doctor went to medical school to learn how to diagnose disease and prescribe medication. They're brilliant at what they do, but they were trained to see only symptoms and treat them in isolation. Here's the fundamental problem. Their tests look for disease. And perimenopause? Perimenopause is not a disease. It's a natural transition. So when you come in with brain fog, crushing fatigue, anxiety, mood swings, and joint pain, your doctor orders standard blood work. They're looking for cancer, anemia, diabetes, all conditions that show up as abnormal on conventional tests. When your results come back within normal population ranges, they tell you you're fine. Maybe it's stress. Maybe you need to exercise more. And here's a prescription for sleep or anxiety. But they're not equipped to ask, what does optimal function look like for you? What imbalances are creating these symptoms even though you don't have a diagnosable disease? That's not a failure of your doctor. It's a failure of the medical education system and the healthcare model itself. Let's consider symptoms versus root causes. Let me explain the difference between how conventional medicine approaches perimenopause versus integrative medicine. Conventional medicine asks, what diseases do you have? What symptoms can we suppress? You can't sleep? Here's a sleep medication. Your blood pressure is up? Here's a blood pressure pill. You're anxious? Here's an antidepressant. These might address those symptoms temporarily, but they don't ask why. Integrative medicine asks, why is this happening? What are the root causes creating these symptoms? And here's what's critical to understand. It's often not just hormones. Yes, estrogen and progesterone fluctuations during perimenopause can affect everything, like your brain chemistry, your sleep, your temperature regulation, your mood, your metabolism. But other systems become imbalanced during this transition as a cascade effect, creating symptoms that look exactly like hormone issues, like gut dysbiosis. Your microbiome affects hormone metabolism, mood, energy, and inflammation. And 90% of serotonin is produced in your gut. So if your gut isn't healthy, neither is your mood. They're parasites. They're more common than you think. And they create anxiety, sleep disturbances, brain fog, and digestive issues that get blamed on perimenopause. There's heavy metal toxicity. This accumulates over decades, and it disrupts neurotransmitter production and cognitive function. It could be food sensitivities. We check on whether they're there because they create systemic inflammation that manifests as brain fog, joint pain, mood swings, and fatigue. We also look for metabolic dysfunction. That includes insulin resistance, blood sugar dysregulation, inflammation, all accelerating during perimenopause. And then we look for bacterial overgrowth. That prevents nutrient absorption and creates the bloating and discomfort that you can't really explain. Conventional testing misses all of this. You're told you're normal while you're falling apart because they're only looking for disease, not dysfunction. And let's face it, your career is at stake. Now, let me tell you why this matters so much to your career. Did you know that 20% of midlife women will quit their jobs because they feel they can't keep up? 20%. 1 in 5 women who spent decades building their careers, earning their experience, climbing the ladder, and they walk away because their symptoms are so debilitating and they just can't get help. Think about what that means. These aren't women who don't care about their careers. These are high performers who've worked too hard to just give up. But when brain fog makes you second guess yourself in every meeting, when fatigue is so crushing you can barely make it through the afternoon, when anxiety spikes right before an important presentation, when you can't sleep, you can't think clearly, can't show up as the capable professional you've always been, and when your doctor tells you everything's normal and offers you prescriptions that don't address the root causes, what choice do they feel they have? This is preventable. This is addressable, but not with a 15-minute appointment and symptom-suppressing medications. This is where a health coach offering functional medicine testing makes the difference between surviving and thriving at work. So what does a health coach do that your doctor can't? First, there's time and comprehensive assessment. Your doctor has 15 minutes. A health coach has the time to understand your complete health history, your symptoms, your goals, your lifestyle, and create a comprehensive picture of what's happening. Second, functional medicine testing reveals root causes. Not just, are you sick enough to treat, but what does your body need to function optimally? We test for complete hormone panels, not just levels, but metabolism and ratios. We test for comprehensive gut health, including microbiome balance, parasites, bacterial overgrowth, intestinal permeability or leaky gut. We test for thyroid function, and that's beyond just TSH. We test for nutrient status, including the vitamins and minerals essential for energy, mood, and cognition. We test for food sensitivities to identify inflammatory triggers, creating symptoms. We test for heavy metal toxicity to see what's accumulated and affecting your function. And we test for metabolic markers, insulin sensitivity, inflammation, and cardiovascular risk. This testing identifies the specific imbalances creating your symptoms. Not guessing, not trial and error, knowing exactly what needs to be addressed. And third, there's personalized protocols that are based on your data. Once we know what's happening, we create targeted interventions, specific nutrition strategies for your imbalances, targeted supplementation based on your deficiencies, gut healing protocols if needed, parasite elimination if that's necessary, detoxification support for heavy metals, hormone optimization strategies, sleep optimization techniques, and stress management approaches that actually work for busy professionals. And fourth, we provide ongoing support and adjustment. Perimenopause isn't static, it's a transition. What you need today might be different than in 3 months. A health coach monitors your progress, adjusts protocols, and supports you through the entire journey. And finally, fifth, we provide advocacy and education. A health coach helps you understand what's happening to your body, how to communicate with your doctor, what to ask for, and how to advocate for yourself in the medical system. This is the difference between surviving perimenopause and thriving through it. This is the difference between watching your career crumble and maintaining your professional edge. This is the difference between becoming that 20% who quits and the 80% who stays strong. There is an alternative path. So instead of letting your career, your relationships, and your goals fall around your feet, know there's another option. You don't have to choose between your health and your career. You don't have to accept normal lab results while you're falling apart. You don't have to suffer through 7 to 15 years of symptoms hoping they might pass. You don't have to become part of that 20% statistic. You've worked too hard to get to where you are. You have goals you're still working towards. You have impact you want to make. You have expertise that's more valuable now than ever. Your ambitions don't disappear just because your hormones are fluctuating, but you need your body to cooperate. You need answers, not dismissals. You need root cause resolution, not symptom suppression. You need someone who understands both the science of what's happening in your body and the reality of maintaining professional excellence. A health coach offering functional medicine testing can identify why you're struggling, and if that's hormones and beyond, address the root causes creating your symptoms, restore your energy, your clarity, your confidence, help you show up as the capable professional you've always been, support you in maintaining and even advancing your career, and prevent you from becoming part of that 20% who quit. This is the missing piece in your perimenopause puzzle. Not because your doctor is bad, but because the symptom they work with wasn't designed for this, and you need more than the symptom can provide. If you're tired of being told everything's normal while your career, your relationships, and your quality of life are suffering, if you're ready to get real answers about what's happening in your body, if you refuse to become part of the 20% who walks away from everything they've built, I want to invite you to schedule a discovery call with me. We'll explore how comprehensive functional medicine testing can identify your specific imbalances, whether it's hormones, gut health, parasites, heavy metals, nutrient deficiencies, or a combination of them all. We'll create your personalized roadmap from surviving to thriving, because you deserve more than prescriptions that mask symptoms. You deserve answers. You deserve solutions. You deserve support from someone who has the time, the expertise, and the testing tools to help you figure out this puzzle. You didn't build this career to let perimenopause destroy it. You didn't earn your expertise to walk away because your body isn't cooperating. You didn't work this hard to become a statistic. The missing piece is in your perimenopause puzzle. It might just be a health coach who gets it. The link to schedule your discovery call is in the description below. Let's solve this puzzle together. And remember, you have options, you have support, and you're not alone. If this video resonated with you, please like and subscribe for more content about the real root causes of midlife health issues.